You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello, thank you for tuning into the Pregnancy Podcast. In today's episode, we're asking the question, are vaginal exams really necessary? And diving into what the evidence says. A vaginal exam is a procedure that can be offered to you in the weeks leading up to your due date or during labor. These exams have become routine, but there are questions about whether they are truly necessary, how useful the results really are, and whether the evidence supports their widespread use. In today's episode, we will explore what happens during a vaginal exam, what the results can and cannot tell you, and the research on the potential benefits and risks. The goal here is not to promote or discourage any procedure, but to empower you with the knowledge and choice so that you can make an informed decision that you are confident in. You can find the full article and see all of the resources for this episode at pregnancypodcast.com/vaginal exam. You are on the public feed of the podcast, which gives you access to a limited number of episodes, and you will hear advertisements. Become a Pregnancy Podcast Premium member for an ad-free experience. Plus, you get access to hundreds of episodes exclusively available to premium members. One of my favorite things about doing this podcast is that I spend so much time researching, digging through evidence, going down all the rabbit holes so that you don't have to. Whatever you're looking for more information on, whether it's a pregnancy symptom or if you're debating about including something in your birth plan, there is an episode of the Pregnancy Podcast that has all the information you need. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium. VTech is the #1 baby monitor brand in North America and is trusted by millions of families. The VTech VM901 baby monitor makes monitoring effortless whether you're at home or away. With a 1080 pixel HD camera and a 5-inch parent unit, it's designed for convenience and reliable performance. Check out the VM901 baby monitor at pregnancypodcast.com/VM901 and save 20% with the code VTPodcast20. 8 Sheep Organics makes amazing 100% clean, natural pregnancy products. From skincare to treating common pregnancy symptoms, 8 Sheep Organics has you covered. Every product they offer comes with a 100-day happiness guarantee. You can try it completely risk-free, and if you're not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you go to pregnancypodcast.com/8sheep. That's the number 8 and sheep like the animal. AG1 Next Gen is a clinically backed daily health drink that combines a multivitamin, probiotic, and blend of superfoods into one scoop. Now, clinically backed with an advanced formula, this is the perfect time to try AG1 if you haven't yet. If you use my link, you'll also get a free bottle of AG-D3K2, an AG1 welcome kit, and 5 of the upgraded travel packs with your first order. So make sure to check out drinkag1.com/pregnancypodcast to get started with AG1's Next Gen and notice the benefits for yourself. That's drinkag1.com/pregnancypodcast. A vaginal exam is exactly what it sounds like. Your doctor or midwife will examine your vagina to assess your cervix. Before this exam, you will be asked to empty your bladder. That can make you more comfortable And really, that's a good habit to adopt before any appointment late in your pregnancy because your growing uterus puts additional pressure on your bladder. In this appointment, you will remove your clothing from the waist down and then lie on an exam table. During the exam, your care provider will insert 1 or 2 gloved fingers into your vagina to reach your cervix. They are assessing whether it has begun to dilate or open and efface or thin. This exam can also provide information about the position of the cervix and the position and station of your baby. After this exam, it is common to have some light spotting or increased discharge, especially if your cervix has already started to soften or dilate. It's important for you to know, as we're talking about this topic, that as your body prepares for labor, there are a lot of changes that happen that you may not feel or notice. Every part of this process works together to create the perfect conditions for your baby to be born. To really better understand this procedure, let's explore exactly what your care provider is looking for and what the measurements they take actually mean. I talk about a vaginal exam in terms of being an intervention, but is it really? Well, an intervention is defined as the action or process of intervening or an action taken to improve a situation, especially a medical disorder. So when we apply these definitions to pregnancy or birth, I define an intervention as any action taken to alter the course of your pregnancy or birth. The results of a vaginal exam can influence your decision to induce labor, to opt for a cesarean birth, and it can affect your attitude or expectations about when you will go into labor or how your labor is progressing. While this may not be the same type of intervention as something like a cesarean would be, yes, a vaginal exam is an intervention. I mentioned that this exam is examining your cervix. The cervix is the lower narrow part of the uterus that connects to the top of your vagina. And your cervix essentially acts like a doorway between your uterus and the vagina. During pregnancy, it stays closed, firm, and long to keep your baby safely inside the uterus. As you get closer to labor, your cervix will start to prepare for birth by softening, dilating, which is opening, and effacing, which is thinning, and that all will allow your baby to pass through the birth canal. Cervical dilation is measured in centimeters. The first stage of labor is from the onset of labor until your cervix is dilated to 10 centimeters. To give you kind of a tangible idea of these dilation measurements, you can think about 1 centimeter is about the size of a Cheerio, and 10 centimeters is about the size of a bagel. Something in between, like 4 centimeters, is about the size of an Oreo cookie. While I know it can be a little intimidating to think about your cervix dilating all the way to 10 centimeters, remember this is necessary for your baby to be born. A doctor or midwife will measure cervical dilation by inserting 2 fingers into your vagina and placing them on either side of the vaginal opening to estimate the difference between their 2 fingers. One study looked at the accuracy of vaginal exams. They had a researcher perform an exam immediately after a clinician and then compared the results. The 2 agreed on the dilation measurement in only 49% of cases. So that means in more than half of them, their assessments differed. In 11% of cases, the measurements were off by 2 centimeters or more. These discrepancies really show that vaginal exams are not an exact science, and results can vary between providers. Another thing that they are looking for is cervical effacement. This is measured as a percentage from 0 to 100. At 0%, your cervix is closed and it's hard. It will feel like the cartilage at the tip of your nose. When your cervix is effaced at 100%, it is paper thin and it feels soft, kind of like your lips. During your pregnancy, your cervix is sealed with a thick collection of mucus called the mucus plug. This barrier helps protect your baby because it prevents bacteria from entering the uterus. But as your cervix begins to soften, thin, and open in preparation for labor, that mucus plug can loosen and it can come out. If this happens, you may notice a small amount of thick or jelly-like discharge. It could be clear, it could be yellowish, brownish, or it could be tinged with blood, which is why it is sometimes referred to as a bloody show. Losing your mucus plug is a normal sign that your body is preparing for labor, but it's not a sign that everyone experiences. If you do lose your mucus plug, it does not necessarily mean that labor will start immediately and your birth could still be days away, but it is a sign that things are moving. In addition to measuring dilation and effacement, your provider will also assess both the position of the cervix and the position and descent of your baby. During pregnancy, your cervix is posterior, so it's pointing towards your tailbone. Near labor or after labor starts, your cervix moves forward to an anterior position. So it points towards your pelvic bone, and this gives your baby an easier path through the birth canal. When a doctor or midwife does a vaginal exam, they will take note of whether your cervix is posterior, mid-position, or anterior. They will also be looking for the station of your baby. In the weeks or potentially the hours leading up to your birth, your baby will settle deeper into your pelvis. This is referred to as lightening or as your baby dropping. And the position of your baby's head in relation to your pelvis is described in terms of station. This is measured on a scale from -5 to +5. At a station of -5, your baby's head is still high and it's not yet engaged in the pelvis. A 0 station means your baby's head is level with your pelvic bones and your baby is considered engaged. A +5 station or +5 station means that your baby's head is crowning and it's actually visible at the vaginal opening. Like cervical measurements, measuring the station of your baby is not an exact science. One study used a specially designed birth simulator to examine how accurately doctors could determine a baby's station. The results found that determining fetal station by touch alone is really not very reliable. Residents were inaccurate in 50 to 88% of cases, and even experienced physicians made errors 36 to 80% of the time. In addition to station, your doctor or midwife will also assess the position of your baby. They may be able to tell this by feeling your belly, and they can also determine which way your baby is facing by feeling their skull during a vaginal exam. Before your baby's born, the bones in their skull are not yet fused, and that allows their head to mold and pass more easily through the birth canal. This is why some babies that are born vaginally have a slightly cone-shaped head at birth. Do not panic. If this happens, it is completely normal and it is temporary. The soft spots where the skull bones meet can help your provider identify your baby's position. I know that's a lot of measurements that we got into a lot of detail on. Your doctor or midwife can take all of these measurements and use them to calculate a Bishop score. A Bishop score is a scale from 1 to 10 that was originally developed to predict the likelihood of going into labor. Doctors used to think of this as a score of 1 indicated labor was about 3 weeks away, and a score of 10 indicated labor would start within a few days. Recall that all of the measurements are estimates, and all of them are subject to a margin of error. Today, we know that a Bishop score may not be the best predictor of when you will go into labor. However, It can be very relevant if you are considering inducing labor. A Bishop score is the most commonly used method to rate the readiness of the cervix for labor induction. And there is evidence that inductions tend to be more successful when there is a higher Bishop score. One study showed that an unfavorable Bishop score, which was considered 5 or lower, was the main factor linked to a failed induction and a higher chance of cesarean birth. Let's take a look at what the clinical guidelines are. The American College of Obstetricians and Gynecologists states that cervical examinations are indicated to determine labor progress, but there is insufficient evidence to provide guidance on the frequency of cervical examinations in labor to assist with labor progress or dystocia. ACOG goes on to state it is reasonable to perform cervical examinations as often as needed when clinically indicated. Essentially, it's up to your doctor to determine when they deem a vaginal exam is necessary. And then, if they suggest it, then the decision of whether they go through with performing that vaginal exam would employ both shared decision-making and informed consent. Internationally and outside of the US, there is more of a consensus on vaginal exams during labor, and that is to offer them every 4 hours. The National Institute for Health and Clinical Excellence, that's in the UK, recommends that providers offer expecting moms a vaginal examination when they enter a hospital in suspected established labor and every 4 hours as labor progresses. The World Health Organization states vaginal examination at intervals of every 4 hours is recommended for routine assessment of the active first stage of labor in low-risk women. A Cochrane review examined routine vaginal examinations compared with other methods or with different timings to assess labor progress. The researchers found no strong evidence that frequent or routine exams improve outcomes for mothers or babies compared to less invasive or less frequent alternatives. Ultimately, they conclude that further large-scale randomized controlled trials are required, but overall, this review suggests that while vaginal exams are widely used, their benefit in improving outcomes is not firmly supported by high-quality evidence. So if this is not a strongly evidence-based practice, why is it so routine? So much of what happens during your birth occurs internally, and it's very difficult for a doctor or a midwife to know exactly how your labor is progressing. Vaginal exams and the measurements that they provide are appealing because they give your provider measurable signs of progress. These primarily offer 2 key pieces of information. One is how your labor is progressing. The other is whether your cervix is fully dilated to 10 centimeters before pushing begins. For you, the value of a vaginal exam really depends on what you hope to gain from the information. And understanding the results and how they may or may not affect your care can help you decide whether the potential benefits outweigh the possible risks or the possible discomfort. Before we talk about exactly how your doctor measures progress and reaching full dilation before pushing, as well as risks of vaginal exams, I would like to thank the sponsors that have supported this episode. A lot of companies have exclusive discounts for pregnancy podcast listeners. You can always see discounts and promo codes at pregnancypodcast.com/resources. VTech is the #1 baby monitor brand in North America and is trusted by millions of families to deliver crystal clear HD video, reliable performance, strong night vision, and convenient smartphone access. The VTech VM901 baby monitor makes monitoring effortless, whether you're home or away. With a 1080 pixel HD camera and a 5-inch parent unit, it's designed for convenience and reliable performance. You get free access to the My VTech app with no fees. You can remotely pan, tilt, and zoom. There's a 120-degree wide-angle lens, infrared night vision, two-way talk. There's even built-in soothing sounds and lullabies, and split-screen support for multiple cameras. The VM901 baby monitor is designed for convenience and reliable performance. As the #1 baby monitor brand in North America, VTech is trusted by millions of families. Check out the VTech VM901 baby monitor at pregnancypodcast.com/VM901 and save 20% with the code VTPodcast20. I know you've heard me talk about AG1 on the podcast. This is a clinically backed daily health drink that combines a multivitamin, probiotic, and blend of superfoods into one scoop. I'm super excited to share that AG1's next gen is here. It's the same single scoop once a day, but now clinically backed and formulated with more upgraded vitamins, minerals, and probiotics. Plus, it's now in 3 new flavors: citrus, berry, and tropical, and they are all delicious. AG1's Next Gen is now one of the most clinically backed greens powders. They went above and beyond the industry standard in testing and have made a great product even better. This represents years of development and 4 clinical trials, and you know how much I love evidence and research. This clinically backed formula fills common nutrient gaps and supports gut health, all in the same easy once-a-day ritual. I've been drinking AG1 for years. This is the easiest way to have peace of mind, knowing that I'm covering all of the key nutrients my body needs. Plus, I also love that AG1 supports my microbiome, metabolism, and my immune system. Now, clinically backed with an advanced formula, this is the perfect time to try AG1 if you haven't yet. I've been drinking it for over 3 years. I'm so happy to be partnering with them. So subscribe today to try the next gen of AG1. If you use my link, you'll also get a free bottle of AG-D3K2, an AG1 welcome kit, and 5 of the upgraded AG1 travel packs with your first order. So make sure to check out drinkag1.com/pregnancypodcast to get started with AG1's Next Gen and notice the benefits for yourself. That's drinkag1.com/pregnancypodcast. As a friendly reminder, pregnant or nursing women should seek professional medical advice before taking this or any other dietary supplement. Let's get back to today's episode. Your care provider wants to know that labor is progressing. In the past, doctors expected cervical dilation to progress by 1 centimeter per hour. But research has shown that this 1 centimeter per hour guideline is not realistic and that cervical dilation patterns are not linear. The rate of dilation typically accelerates after 5 or 6 centimeters during the active phase of labor. Plus, the rate at which the cervix dilates and effaces will vary a lot from one expecting mother to the next. As an example, let's say your doctor measures your cervix and you are dilated to 2 centimeters. 4 hours later, they measure it again and it's at 7 centimeters. That is tangible evidence that your labor is moving forward. However, this is not a steady linear measurement. You could take 3 hours to go from 1 to 2 centimeters and then progress to 6 centimeters in under an hour. Next, let's talk about reaching full dilation before pushing. It is widely accepted in the medical community that you should be fully dilated to 10 centimeters before beginning to push. The reasoning behind this is that if your cervix is not completely open, pushing will not effectively help your baby move down because there will not be enough space for them to pass through the birth canal. Plus, if you have an unmedicated birth, the urge to push usually occurs naturally once you reach full dilation. But if you have an epidural, you may not feel those same sensations and you may not feel the natural urge to push. ACOG does recommend that pushing commence when complete cervical dilation is achieved. And the only way for your care provider to confirm that you are fully dilated is by performing a vaginal exam. Your cervix has a lot of work to do before your baby is born. And the measurements of dilation or effacement only tell part of the story. These numbers are helpful for your care provider. They give them some data, but they do not capture everything that is happening in your body. How you feel, the changes that you sense can be just as meaningful as any measurement. And you have the unique advantage of experiencing your labor from the inside. So you have insight into your own progress that your doctor or midwife may not see. Given all of the information we have covered so far, what exactly does a vaginal exam tell you? These can provide useful information, but they can't accurately predict when labor will start or how much longer it will last. You could be dilated to 2 centimeters for weeks before your labor begins and still go past your due date. And during labor, remember, progress is not linear. You may go from 2 to 3 centimeters in an hour, but there's no guarantee that in another hour you will progress to 4 centimeters. Your body is constantly making changes to prepare for birth, and many of those changes are not visible or measurable during an exam. Some expecting mothers may want to know the status of their cervix simply out of curiosity, even understanding that it may not accurately predict when labor will start or how long it will last. If you are simply curious, that's a completely valid reason to opt into it. Remember, this is completely your choice. And remember, if you are considering an induction, knowing whether your cervix has started to dilate and efface may indicate that you have a higher probability of a successful induction. We've talked a lot about exactly what happens in a vaginal exam, what all of the measurements that are taken mean, how those results are used, and what some of the benefits are. However, there are risks involved with vaginal exams. And as with any procedure, your doctor or midwife should discuss all of the risks and benefits with you and then only proceed with your informed consent. This conversation is part of shared decision-making where you and your care provider work together to decide what is best for you and your baby. You can absolutely ask questions to help understand your options. And as always, you can opt out of any procedure you are not comfortable with. One risk is that vaginal exams can be physically uncomfortable. A study based on interviews with women after birth found that 82% reported pain or severe pain and 68% reported discomfort during the exam. This discomfort can happen for several reasons. It involves inserting fingers into a very sensitive area, and your cervix and vaginal tissues may already be tender or swollen late in your pregnancy or during labor. Also, if you are feeling anxious or tense, that can make the muscles around the vagina tighten, which can increase discomfort. There is also a risk of infection due to the chance of bacteria from the vagina being pushed up into the cervix. A large study of over 22,000 births examined whether the number of vaginal exams during labor affects the risk of infection. And this study found a clear pattern that the more vaginal exams performed, the higher the risk of infection. Women who had 5 or more exams were significantly more likely to develop fever, chorioamnionitis, which is a uterine infection during labor, or postpartum infections. The authors concluded that performing 5 or more vaginal exams independently increases the risk of developing a fever related to infection, and that the risk rises as the number of exams increases. There is one other risk that is often overlooked, and that is the psychological impact of a vaginal exam. How the results are communicated can shape your emotions and expectations. You may be super excited if it sounds like labor is starting soon. You may be disappointed if it seems like your labor is progressing slowly. If you expect labor to begin right away and it doesn't, that can lead to frustration or anxiety that your body is not progressing as quickly as you or your care provider hoped. It's really important to understand what the results of a vaginal exam truly mean and what they do not. If anything is unclear, ask your doctor or midwife to explain the findings and exactly what they indicate for your unique situation. Remember, while this data may be helpful, it does not give a clear picture of when labor will start or how much longer your labor will last. In the future, there may be greater access to alternative ways of assessing cervical dilation and your baby's position using an ultrasound instead of a manual vaginal exam. The main advantage of this approach is that it's much less invasive. That can help reduce discomfort and reduce some of the risks associated with traditional vaginal exams. One study found that transperineal ultrasound, that is an ultrasound that's placed on your perineum, was effective at diagnosing active labor for 4 centimeters dilated or more. It was less reliable when dilation reached 8 centimeters or more, or after the membranes had ruptured or the water had broken. Another study compared vaginal examination to a transperineal ultrasound, and they were looking at outcomes on pain and anxiety. This was a randomized controlled trial that found pain levels were significantly lower during ultrasound exams, although anxiety levels were similar between both groups. A third study found that ultrasound was more accurate for assessing fetal head position and station, but less accurate for measuring cervical dilation than a traditional vaginal exam. As technology advances, transperineal ultrasound could become a more widely available option to assess progress of labor. If this is an approach that interests you, ask your doctor or midwife whether this is an available option where you plan to give birth. As with any procedure, you have choices when it comes to vaginal exams. You can decline them altogether. You can limit how often they are performed. You can request one if you would like to know what those measurements are. You can also postpone. If your provider offers an exam at 38 weeks and you prefer to wait until closer to your due date, you can opt to do that. Just the same as in labor, you can always ask that they wait longer. Unfortunately, not all interventions come with full informed consent, especially in cases when providers view an intervention as a very simple routine procedure. Anecdotally, there are many mothers who were not given a full conversation about vaginal exams during labor. It tends to be more common that it is, okay, next we're going to do a vaginal exam, rather than here's a procedure that's available, here's the risks, here's the benefits, what would you like to do? After listening to this full episode, you know the potential benefits, the potential risks, you know the limitations of vaginal exams, so you can have an informed conversation with your doctor or midwife. And I encourage you to discuss this with them before your birth so that you can better understand their practice and whether or not this is something they routinely use, and you can also express your preferences. As you're having a conversation with your doctor or midwife, The BRAIN acronym is a fantastic framework to evaluate any intervention, and it's fantastic for a vaginal exam. So the word BRAIN, each letter represents a question you can ask to determine whether any intervention is the right choice for you and your baby. B stands for benefits. What are the benefits? R stands for risks. What are the risks? A stands for alternatives. You can ask, what are the alternatives? You may want to ask whether transperineal ultrasound is an option. I stands for intuition. What does your intuition tell you? And N stands for nothing. What happens if you do nothing? So if you decline a vaginal exam and it's not done, how will that affect your care? Remember, the goal is for you to make an informed choice that you feel confident in, not simply to avoid or accept a procedure. This is something that you may want to include in your birth plan. Writing a birth plan is a very valuable way to start meaningful conversations with your doctor or midwife and to really clarify your preferences. But simply handing over a typed sheet during your labor will not guarantee the birth experience that you want. The real value in a birth plan lies in the preparation and discussing your wishes with your partner, your doula, if you will have a doula present, and your doctor or midwife ahead of time so that everyone is on the same page. The Pregnancy Podcast has a lot of resources to help you craft a birth plan, and I will include links to all of those at the end of the article for this episode. One parting thought on this topic: vaginal exams can provide useful information, but they're not the only way to understand how your body is preparing for birth or how you are progressing during labor. The most important thing is that any procedure aligns with your preferences and that it's done with your informed consent. And when you understand the evidence, you ask questions, you can make decisions that you feel confident about and ultimately get closer to your desired birth experience. To recap today's episode, we went through everything you could possibly need to know about vaginal exams. We talked about what actually happens during that procedure, everything that your doctor or midwife is looking for, changes to your cervix like dilation and effacement. I covered the mucus plug or your bloody show, went through how your doctor will also look for the position of your cervix as well as the position and station of your baby, how all of those measurements can be put into a Bishop score, which can be particularly useful if you are considering inducing labor. I also covered clinical guidelines from organizations like ACOG and the World Health Organization. We talked about some of the evidence on performing routine vaginal exams and really got into the value of a vaginal exam for your care provider versus the value to you. Remember, this can tell you that there is progress happening, but it can't tell you how quickly your baby will be born or how quickly you will go into labor. I also covered risks of vaginal exams, including physical discomfort, risk of infection, and psychological effects. Plus, I talked about some interesting research showing that a transperineal ultrasound may be an alternative to a traditional vaginal exam. And then we ended with some tips for talking to your doctor or midwife and some simple questions that you can ask so you can make a decision that you feel confident about. I would like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. Please share this episode if you know someone who could benefit. So many listeners discover the podcast through recommendations, and I appreciate you sharing. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/vaginal exam. If you're looking for more evidence-based information, or you would just like an ad-free experience, become a Pregnancy Podcast Premium member. Premium members get every single episode of the podcast ad-free, including hundreds of episodes exclusively available to premium members. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.